children's services and in adult services here in the UK. I've managed a team, a child protection team, and I've worked as a senior manager delivering both service and organisational change in health and social care here in Greater Manchester. And one of my firm beliefs is that safeguarding is fundamental and integral to delivering a good quality health and social care service. So I've put together this course. It's a very basic course. It's a whistle-stop tour, so a very quick tour of safeguarding. If you turn on to the next slide, Mahan. Thank you. These are the learning outcomes for today. So hopefully by the end of this workshop, you should be able to understand what safeguarding means. I'm sure you understand what safeguarding means anyway, but we will go through definitions of that. We'll look at it with both a legal and an ethical context. So we'll look at it in what our statutes say, so what the law says we have to do, but also around our professional ethics about what we want to deliver when we're delivering a good quality care. We'll look at the principles of safeguarding. So although we have the legislation which basically directs us as to what we have to deliver, that will be implemented by policies and by guidance. And there are basic principles which fall out of that law. So we'll look at those. I'll define different types of abuse and neglect. I'm only going to concentrate on the more prevalent causes of abuse and neglect. So you will see that I've focused on the most prevalent categories of abuse, but we'll look at those different types. We will define them, and we will look at some signs and symptoms. You'll know what to do if you suspect or detect that abuse is occurring with people that you work with or around you, or with the patients that you see on a daily basis. You'll know how to respond appropriately to a disclosure of abuse if somebody starts to tell you that they are in an abusive situation. And I've also included a little bit around whistleblowing, which is really around standards of care. So it's around good quality care and what we do if we see that that is not happening. Okay, move on to the next slide.